Hello everyone, welcome to GrowMed. If you're new to GrowMed, subscribe to GrowMed and tap the bell icon so that whenever I post a video, you will get a notification. So in this video, we will look at some important images from the gynecology and the genitourinary system, which are frequently asked in the Fmge. So I've already uploaded videos, part 1 and part 2 videos on the important images from the radiology. So you can go and watch them on my YouTube. The link is given in the description box. Also join me in the Telegram and follow me on Instagram for more information related to the Fmge. So let's start the video. So all these are images of the hysterosalpingography, okay, HSG, and these are majorly done to look at the anomalies of the uterus. So one by one we will look at some anomalies. The first is the septate uterus. As you can see here, there is a septate and the contrast is not covered in the fully. So there's a gap here which will be suggestive that the uterus is a septate uterus. Then the next image, as you can see here, the contrast is going on into one side. So this image is seen when there is unique cornuvate uterus. And the next image, as you can see here, that the contrast is going different, okay, into different directions. So this is suggestive of the bicornuvate uterus. Then the next image, as you can see here, this image is suggestive of uterine didelphys, because there are two uterus and there are two vagina. Kind of anomaly is called as uterine didelphys. Okay, then moving on to the next image, as you can see in this image, there's a filling defect, and this classical finding is seen with the Asherman syndrome. So Asherman syndrome is also a very important topic, and it can be simple image based question asked in relation with the radiology, or giving a case they can ask this question in the gynecology also. Then moving on to some ultrasound images. The first image, a very famous image and very important image from the Fmge point of view. So this is a repeat image, and every year this image is asked, and this kind of appearance is called a snowstorm appearance, and this is seen with, so this is seen in the molar pregnancy hydatiform mode. Okay, so this is a very important image. Then moving on to the next image, as you can see here in this image, the follicle size is increased. The follicle appears bigger than normal, and this classical finding is seen with the ovarian hyperstimulation syndrome, and it is usually seen when we give the IVF treatment. Okay, so this is also asked as a one-liner, and this image is also important. Then the next image, this is also a very important image, because this image is seen with the PCOS, which is the most common problem, gynecological problem. As you can see here in this image, the follicles, they are small, and multiple follicles seen in the ovary arranged in the periphery, which are giving a necklace of pearl appearance. Then moving on to the next image, this image, as you can see here, about the image, these are the images of the twin pregnancy. So twin pregnancy is also a very important topic, and in this you need to identify which of the following will be dichorionic and monochorionic. So the first image, as you can see here, it looks like a lambda, so it is the lambda sign or the twin peak sign. So this sign is called as a twin peak or the lambda sign, and this is seen with the dichorionic or diamniotic pregnancy. Okay, diamniotic or dichorionic gestation. And the next sign, this is the T sign, and this is seen in monochorionic diamniotic gestation. So these two also images are very important, so you need to look at them. Then let's discuss some genitourinary disorders. So very important image, and this question is repeated almost every year. Okay, so this question can be asked in relation with the surgery also. So let's look at them now. This is seen with the horseshoe kidney. As you can see here, the kidney looks like a horseshoe, and it is not able to ascend up due to the inferior mesenteric artery. Then moving on to the next image. This image is of the bladder, the neurogenic bladder. And this appearance is called as the Christmas tree bladder. So in this image, you can see here that the bladder is distended and there are multiple diverticulas present. Then moving on to the next image. This image, it is a MRI image, and it is of an autosomal dominant polycystic kidney disease. Okay, so as you can see here that the bone is black in color, and you can see multiple cysts in the kidney. So a question was asked that which of the following is correct regarding the given image. And there were multiple options like MRI and autosomal dominant polycystic kidney disease, CT and autosomal dominant, then X-ray and something like that. Okay, then so the option was the MRI and the autosomal dominant polycystic kidney disease. Then moving on to the next image, this image is called as the Mickey Mouse appearance of the bladder, and this image is seen with the bladder diverticula. Then moving on to the next image, as you can appreciate here in this image, the kidney is calcified and this is called as the putty kidney, and this is seen with the TB. So this is also a very important image. Then moving on to the next image, so the question was asked, what investigation is being performed in the given image, and it is the retrograde urethrophy. Then moving on, so now let's look at some IVP findings and their corresponding disorders. So in the first image, as you can see here, the kidney, it looks like a paintbrush appearance, and this is seen with the medullary sponge kidney disease. In the next image, you can appreciate that the renal calyx, they look like the spider leg. So this is called as a spider leg appearance, and this is seen with the polycystic kidney disease. In the next image, as you can see here, the ureter is dilated. The ureter is dilated and even the renal calyx is dilated. So this finding is seen with the hydronephrosis. Then moving on to the next image, as you can see here in the blood near the bladder area, you can see that it looks like a cobra head appearance. Okay, so it is called as cobra head or adder head appearance, and this is seen with the urethrocoel. And the next image, the drooping lily sign, as you can see here that the renal calyx, it appears like a drooping lily. So this sign is called as a drooping lily sign, and this is seen with the duplex collecting system. So that's it in this video, guys. This was a short video on the important images, and I think this video will help you in your last minute revisions. So if you want this PDF, you can join my Telegram channel. I'll be sharing this PDF. Thank you so much for watching this video. Like the video, share this video with your friends, and subscribe to Chromed for more such videos regarding the Fmge. Thank you so much. Bye bye.